President, I tried to get the microphone down, but I'm pleased to be here today with the President to help kick off National Nurses Week. We at the Department of Health and Human Services value the important and diverse roles nurses play in keeping America healthy. You provide a full spectrum of health care, and you're on the front lines in our hospitals. You deliver primary care as independent providers, you give vaccinations, and help the elderly with nutrition and medication. You administer our great healthcare institutions, and some of you have delivered over 125,000 babies every year in this country, and 65% of all anesthesia. We believe that a strong nursing profession is fundamental to an effective healthcare system, and the Clinton administration is committed to strengthening the nursing profession because we value your leadership, the care you give, the knowledge you possess, and the critical services that you provide. Some of America's greatest leaders have been nurses. During the Civil War, Dorothea Dix served the Union as head nurse for 4 years and refused a salary. At the same time, the great abolitionist nurse Sojourner Truth broke down the barriers as she cared for emancipated slaves and wounded soldiers. Margaret Sanger made historic contributions serving poor families in the tenements of New York and educating women about reproductive health care. And today, all of you continue this long tradition of service and leadership. One of your leaders in the nursing profession and one of America's leaders is Virginia Trotter Betts, President of the American Nurses Association. Virginia has enjoyed a long and distinguished career as a nurse, as an attorney, and as an advocate. Because she is a leader in her field, the Clinton administration has recently named her to be a delegate to the World Health Assembly Conference in Geneva, and she'll actually be on her way to represent the United States this weekend. She leads an organization of great sophistication and distinction. She's a good friend of all of ours. Let me present you Virginia Trotter Betts.
Mr. President, Secretary Shalala, and really most especially my nursing colleagues, I'm deeply honored to be here today speaking on behalf of the nation's 2.2 million registered nurses, many of whom, even as we speak, are on the front lines delivering health care. As National Nurses Week opens, I'm deeply grateful to President and Mrs. Clinton for recognizing the enormous contributions that nurses make to our nation's health. I'm thrilled to be standing in this lovely setting for a tribute to those professionals who have worked creatively and tirelessly, and yet so often and too often invisibly. This is truly a historic moment for nurses as we bring our vision for America's health to the White House and embrace the purposes that President and Mrs. Clinton and the Secretary hold out for health reform. Nursing's vision for health care comes from the thousands of encounters that nurses have every day with patients and their families for whom health care reform is so urgently needed. It comes from participating in the marvelous miracles of medical science while simultaneously seeing basic health care services become increasingly inaccessible. Nurses know only too well the tragic results of the lack of patient education or early intervention or primary prevention. Just as nurses are expert in monitoring their patients, we have also expertly monitored the healthcare system and have grown increasingly alarmed at the deterioration of the delivery of healthcare services. Nurses have a vision for health reform that is born of nursing's philosophy of promoting health, preventing illness, and using resources wisely while making the patient's well-being our top priority. Thus, we have called for a new system in which the need for expensive tertiary care may be reduced by a greater availability of preventive and primary care. Reliance on expensive hospitalization and technology can be reduced with increased community care, especially through revitalized public health nursing. Costs can be brought under control by using health care resources wisely, including health providers, in the most resourceful way. quality patient care and satisfaction of the consumer is both the goal and the result. If ever we needed the united resources and imagination of all the nation's nurses, the time is now. We have an enormous job to do if we are to bring health care to the uninsured, the disenfranchised, as well as to continue to provide quality care to the entire population. We will continue to need the talents and skills of nurses to deliver care in hospitals, yet we will also need many more nurses in the community, in outpatient school and workplace settings. Nurses have been key in assessing the need for change and in shaping a truly workable reform system. Now we must work with the President to see that the plan as a whole is adopted by Congress. Nurses have traveled a very long way to reach this beautiful garden today. Far from the silent angel in white of history, we are, because of our frontline participation in delivering care, uniquely articulate about the need for change. We have been privileged to participate in crafting the President's reform plan, and we are pleased that nursing's concerns are being heard. The American Nurses Association is optimistic that nurses will provide a vital and expanded role in delivering health care in the future as highly skilled, trusted, and cost-effective providers. We are grateful to the President, Mrs. Clinton, and the Secretary for making the well-being of the nation's health system one of their top priorities, and together we will make this vision a reality and truly put people first. Now, colleagues, I would like to introduce someone to you that the last time I had the honor of introducing the next speaker was on the occasion of the American Nurses Association endorsement of a candidate for president called Bill Clinton. Yeah. The American Nurses Association recognized then that his vision for health care reform was very closely aligned to nursing's. And then nurses, all of you, I'm sure, in unprecedented numbers all over the country worked enthusiastically and very visibly to elect the Clinton-Gore ticket. We will work, Mr. President, just as enthusiastically now to reach our mutual goals to make quality, affordable health care a right, not a privilege for all in our society. It is therefore my greatest honor to introduce to you now the President of the United States.
Thank you. Thank you very much. Thank you. Thank you. Thank you very much. Thank you very much, Jenny, for that wonderful statement and the introduction. And thank you, Secretary Shalala, for everything you said. I noticed a few groans in the audience when you pointed out that Dorothea Dix worked for nothing. I don't think she was suggesting that you do that. I think she was volunteering to do that, don't you think? I want to say, you know, I knew nurses were miracle workers, having been raised by one, but I don't see how you staved off the rain today. When I first heard 100 nurses were going to be here, I thought to myself, what else can I do? I've given up junk food. I run every day. What more do you want of me? I'm doing my part. I want to say a special word of acknowledgement, too, to the nurses who are in this audience who work here at the White House, who care for me and my family and are available to the other people who work here. They do a wonderful job, and I'm very grateful to them, and they're here and there and around, and I thank them for their presence here. I'd also like to pay a special word of tribute to your president, Jenny Trotter Betts, for hanging it out there with us in the election and bringing the support of the American Nurses Association, and also for being such a forceful advocate for sweeping reforms in our healthcare system. Hillary and I very much appreciate the work that she and the Nurses Association have done, and I know that she's also an old friend of Alan Tipper Gore's, and they're grateful too for her contributions. I'd also like to recognize some of the other people who are here today, including a remarkable nurse whose presence in the Congress is a symbol of your political strength, Congresswoman Eddie Bernice Johnson from Dallas, and my dear friend. She's really a tribute to the practice of good health. I've known her for 20 years, and I look much older and she looks younger than she did the first time we met. I also want to thank all the nurses who've advised our healthcare reform task force and brought such a valuable perspective to that effort. You really made a difference, and we're grateful to you. We're here today to mark the beginning of National Nurses Week, a time for our country to recognize the services that you and your colleagues provide 24 hours a day, 7 days a week, 365 days a year. From inner-city hospitals to rural clinics, from the Red Cross to the armed services, America's nurses always answer the call. Today we're reminded that our nation's 1.8 million working nurses are the backbone of a healthcare system, the largest single group of healthcare providers in America, and I might add, a group that will have to do more and should do more in primary and preventive care if we're going to bring the cost of medical care down. You know better than anyone else what is wrong with this system. You see all the people who show up at the emergency room to get the most expensive care too late because they didn't have a basic primary and preventive health care package. You see the enormous burden of paperwork, squandering more and more hours of nurses and doctors, requiring more and more precious health care dollars to be diverted to clerical expenses instead of to investing in the health of our people. Every day you see these kinds of problems as the nation continues to wait for action on the health care front. I'm here today on this beginning of your week to reaffirm to you my commitment that now is the time to do something about health care and to do it right. One of the most challenging things we have to do in this city at this time is to break a mindset that we have one problem at a time and we'll get on it and we'll only think about that. I believe that this country has at least three huge problems that relate one to the other. One is there are too many people who are unemployed and too many people who are working harder with no gains in their incomes, and it's been that way for a long, long time. Two is the cost of health care is exploding at an unacceptable rate, and yet too few people have coverage, or their coverage is too limited. Third is we're absolutely being consumed by a massive national debt and a growing deficit. And these things are all related one to the other. Now, people say to me, well, we just do one thing at a time. Well, look back over time where that's gotten us. People say, for a long time, people say, well, we ought to just spend money and give it to people and maybe that'll work. That hasn't worked. Then for 12 years, we heard the worst thing in the world is taxes. We'll just cut taxes, especially on wealthy people, and that'll make everything wonderful. Well, that hadn't worked out very well either. So the guy said to me yesterday, said, I know a bunch of people who got tax cuts last year because they used to be making 40 grand a year and now they're making 10. They all got a tax cut. And what I say to you is that we don't want to just keep trying to give people things in a system that is broken. You can't give people government money. You can't give people tax cuts if the system is broken. What we have to do is to attack all these problems at once and not keep giving people things, but give them the means to take care of themselves and to create lives that are productive and good and strong for themselves and their families, their children. That's what we have to do. That's why, yes, we have to reduce spending and increase taxes, mostly on wealthy people who got their taxes cut in the 1980s to bring the deficit down. But we also have to invest carefully in programs that will create jobs and raise incomes, new technologies for the 21st century, and the kind of education and training that will give people work. If everybody in this country who wanted a good job had one, we wouldn't have half the problems we've got. And then the third thing we have to do is to attack the health care crisis, because if we don't, we will never get the government deficit under control. We will never balance this budget, and we will never, more importantly, we will never provide the security that most families need and deserve in a rapidly changing and increasingly insecure world. There are millions of Americans today who cannot change jobs because somebody in their family has been sick. There are millions of others who have no health insurance. There are millions of others who have some health insurance but very little because they work for small businesses who cannot afford a basic package of health care because of the insurance system that we have in this country. There are untold billions of dollars being spent that should not be spent by the people who pay the full price and more for health care, because they have to pay for somebody else's health care who's not covered when it's too late and too expensive, or because they're paying an unbelievable bureaucratic burden for the paperwork burdens of this system. So I say to you, these are false choices. People cannot say to us, you must choose between having a healthy country, an employed country, a country bringing its deficit down. We must do all three of those things, because that's the only way we can, instead of trying to give people something that's not there to give, empower people to seize control of their destiny and bring this country back. That's what we've got to do. There will always be defenders of the status quo. It is easy to say, well, let's just write somebody a check. Even easier to say, taxes are evil. They're out to get you. Right now, you know as well as I do, the lobbyists are lining up, strategizing about how they're going to pick this health care proposal to death. But I'll tell you something, the worst thing we could do, in my opinion, after 400 and something people have worked their hearts out for months and months and months, is to take a dive on the health care thing, to turn away from it, to deal with the inconveniences of it. People say, well, it may cost somebody else some money. Let me tell you something. All those people who don't have health insurance today, they're being paid for by everybody else who's paying the bill. What about fairness to them? Who's thinking about them? I'll tell you something else. We've been reducing defense spending quite steeply, and about all we can, for the last 5 years. And all the savings we hope to have in the peace dividend have been exploded away by rising health care costs and interest payments on this deficit. So it is all related. You've got to have a job strategy, you've got to have a deficit reduction strategy, and you've got to have a health care strategy. Because if you don't have a health care strategy, the American people can't stay well, the American economy can't get well, and you cannot reduce the deficit to zero in this decade. Those things must be done together. We cannot be forced to make that false choice. And so I ask you, you represent 1.8 million people who know the heartache, the heartbreak, and the problems of this system, and who also know that that which is right about our system makes it the best in the world for those who can access it. We are determined to come forward to the Congress with a plan that keeps the best of America's healthcare system, keeps the private provider system, keeps a lot of choice in the system, but deals with the awful problems that you know better than anybody. And I ask you to commit today not to let the special interests tell us that we can't deal with health care, not to let the special interests spook and scare the members of Congress away from doing what is our manifest duty to the people of this country who have working hard and playing by the rules and falling further behind, and instead to give us all a chance to do the work of a generation. And that is really what's being given us in this time, in this Congress, the opportunity to do something that comes along once in a generation to change the whole course of America's future by dealing with these things together, providing security and quality and control of costs in this healthcare system, bringing this deficit down, and pursuing a long-term strategy for a high-wage, high-growth, low-unemployment economy. And they're all together. If you will help me take that message to the Congress, this will be one of the best years the American people ever had. Thank you very much.
Yes. Yes. I think we're supposed to next.
Have you heard anything from Bosnia, sir? How quickly are you prepared to move? Was another guy? There's word that the parliament has agreed on our agreement.
Hold that down. I'm waiting for a call from Secretary Christopher right now. Go take the call.
And then what, sir?
Sir, what happened to your immunization program on the Hill? Why'd you have to dial back on that?
Well, Secretary Shalala says we're going to get a program that will immunize a lot more people. We did the best we could with the money we had. I think, you know, a lot of these things are going to be a function of how much money we have. And I feel pretty good about it. I talked to her about it. She feels good about it. We think it's a big advance over where we are. Thank you.